Hi, welcome to another edition of Comments on Psych Meds by a Psychiatrist. I'm Dr. Ankur Saraya, and this is my series where I just make some comments and observations about some of the medications that I and many psychiatrists commonly prescribe. So today I'm going to talk about Xanax, or generic is alprazolam. Xanax is in a group of medications called benzodiazepines, and they do create some controversy in that there are some people who think that they should not be prescribed. They are a controlled substance regulated by the DEA. Doctors need a special authorization in order to be able to prescribe all controlled substances, including Xanax and the other benzodiazepines. And I think that it's appropriate that they have a special designation. There are certain risks inherent to drugs like Xanax, and I think they warrant the extra scrutiny that they have. That being said, I think that they are an effective medication for certain symptoms and situations, and with the appropriate training and monitoring, they can be used safely. So mainly Xanax is used for treating anxiety. Usually it works immediately or relatively soon after you take it. So it's best meant to be used when you're experiencing active anxiety symptoms, or you anticipate that you're about to have what we call a panic attack. They can also be used to promote sleep, although I personally don't think that that's the best use. Sometimes people end up using them for sleep, but I think there are better options, safer options to help promote regular and healthy sleep. So dose range for Xanax, it's available in as small as 1/4 milligram, and we generally do try to start as low as we can, but it comes in these 2 milligram bars as well, so it's a pretty broad dose range. I think benzodiazepines are best reserved for short-term use and or occasional use. There are patients who do use them every day, but that does create an extra level of risk. And sometimes it's appropriate. People have certain conditions where they are the best approach, but I try to work with people to try to see if we can get them so that they're not having anxiety every day, so they don't need to use Xanax or another benzodiazepine every day. The main thing about coming off of the medications is that you can form a physical dependence. If you're taking them every day for an extended period of time, you should not stop taking them suddenly. It's potentially dangerous, potentially life-threatening. It's not common, but it does happen. So benzodiazepines should not be stopped suddenly. What we do to get people off them is we taper them gradually. We gradually reduce the dose over time, and until we can get the patients to the lowest possible dose, and from there you can stop the dose. Sometimes substituting with a non-benzodiazepine to help smooth the transition. And there are some people who end up choosing to continue to take them long term, though that is not ideal and not the goal. Side effects of the medications, as might be obvious by the fact that they can be used for sleep, they're sometimes sedating for certain people. They can also impair your hand-eye coordination, especially if taken in higher doses. And that's the main arena of side effects, is just some sedation and some slowing of motor function. This is not really directly related to the medication, but I will mention that benzodiazepines in particular should not be mixed with alcohol, because they can they overlap in their effects and can amplify the effects of each other. and that's potentially a dangerous combination, so they should not be combined with alcohol. And in fact, benzodiazepines are sometimes used to prevent alcohol withdrawal when people are detoxing from alcohol. Although Xanax is generally not the benzodiazepine of choice for that, because it's very short acting. It's the shortest acting of all the benzodiazepines that are commonly prescribed. That does mean it tends to be a bit more habit forming, and we sometimes use the longer acting benzodiazepines to help people come off of Xanax if they're having difficulty reducing the dose. I will make a future video about benzodiazepines in general, so follow my channel or comment if you'd like to hear more. Thank you.